So I'm Mary Murphy. I'm a neurosurgeon. I've been a consultant for more than 20 years now. I practice in cranial neurosurgery and also spinal neurosurgery with some stereotactic radiosurgery, that's gamma knife. In terms of cranial neurosurgery, I do a lot of vascular work, so that's dealing with aneurysms, arteriovenous malformations, dural arteriovenous fistulae, and cavernomas. And in the spine, I deal with the cervical spine and the lumbar spine and even the coccyx. The thing I enjoy the most is understanding the impact on patients' lives and understanding how the right answer for one patient is absolutely not the right answer for another patient, even in what you might perceive superficially to be the same situation. So I think what draws you to it in the first place is probably the operating. It requires a lot of skill, a lot of knowledge, a lot of understanding, and that's a challenge. But the most interesting aspect of the work at this juncture in my career is fitting the patient to the right treatment and understanding how the patient's circumstances, their family life, their social setup, their work feed into what's the best decision for them about managing their neurosurgical condition at that particular point in time. I went to university in Dublin, at Trinity College Dublin. After I graduated, I spent a year working in St James's Hospital there. Then I moved to a surgical training scheme in the west of Scotland in Glasgow. At the end of my training, I spent a year as a locum consultant in Cambridge. And after that, I was appointed as a substantive consultant at the Royal Free Hospital. Unfortunately, the unit closed in 2012, but we were very fortunate to move to the National Hospital, where we have great colleagues and a fantastic unit. So I've had a very varied and rich experience across the whole country. And I think this means that I can understand the best place for surgery, the best place for stereotactic radiosurgery, and also for embolization for these lesions. So it gives patients the benefit of a broad experience and an understanding of the alternatives, not just one form of treatment. The relationship I like to have with my patients is one of mutual respect. I think that's a bedrock and the foundation for every interaction that goes on between any doctor and patient. I want to understand their motivations and where they are in their lives. It's important to understand, and it's important to be looking at the patient's trajectory and what it is they want out of their lives and what's important to them, so that you together do make those decisions as well as possible.